There are many barriers to diabetes education. It's challenging. We are sitting inside of a hospital. We should be out in the community. We should be in health centers and senior centers, community centers and universities.
And now I'm here at the ADA studio, and I am with ADA President for Healthcare and Education, Gretchen Youssef, and thank you so much for being here.
Thank you for inviting me.
And I know you're a diabetes educator, and obviously so many sessions to take in this time around. What are you most looking forward to? What's on your list?
So there are just a lot of studies that are going to be presenting results, a lot of medication studies, and the outcomes of these studies may really have a positive impact on persons with diabetes. So I'm excited about hearing about that. The nutrition consensus paper was published this past spring, and they're actually going to be interviewing the authors and talking about healthy dietary patterns and what's best for people with diabetes. And I think this is really important for most people who see patients, physicians, anyone who works with patients to actually attend, because there's so many myths about diabetes, what people should eat, and this provides evidence-based guidelines.
What issues would you say are most important to you that you're focusing on as of late?
So my talk is actually on access to care. It's all about access, and it's really important that people have access to the medications that they need. It's been really challenging lately because insulin prices have more than tripled since 2002, and some people can't afford insulin. And people are dying because they can't afford insulin because they're rationing it. So that's one access point. The other access point that's near and dear to my heart is diabetes education. How can someone self-manage their disease if they don't know what to eat, if they don't know how to take their medication, how to take their insulin? And I see people in our practice that have had diabetes for 20 years with multiple complications that have never sat with a diabetes educator. And right now, the recommendations are that there's 4 critical times people see a diabetes educator, and we're lucky if people actually see them when they come in and have complications.
Why do you think that is?
Well, there are many barriers to diabetes education. It's challenging. We are sitting inside of a hospital. So location's one of the challenges. We should be out in the community. We should be in health centers and senior centers, community centers and universities. Also, the payment structure for Medicare is difficult. There is a bill in the House and Senate right now looking at these barriers, and hopefully it will go through and we'll have these policy changed so it will make it easier for people to access.
Well, it sounds wonderful, and hopefully that will go through and forward. And I want to thank you, Gretchen Youssef, for your time.
Thank you.
Thank you. ADA TV is brought to you from the American Diabetes Association's 79th Scientific Sessions. For more from the meeting, make sure to click these links and subscribe for much more from the world of medicine.